So as you may know, I am a scientist, but also I'm a runner. And just a few weeks ago, last month, I was able to break my own record in marathon. So it was 3 hours, 20 minutes. So I was... Thank you very much. The purpose of my presentation today is to show this. So it's almost over. So this is the history of my marathon record since in the last 12 years. And it's getting better and better. And I got even better very recently. So according to this trend, I should be able to break 2 hours in 2060. I will be 98. So longevity is really, really important to me, and of course to all of you. So in order to achieve longevity, I have been working on this technology, iPS cells, induced pluripotent stem cells. iPS cells are nearly indistinguishable from embryonic stem cells, ES cells. But you don't have to use human embryos. We can make iPS cells from each of you, from your blood cells or skin cells. All we need is a transfer, administration of these 4 factors shown in the upper portion of this slide, 4 genes. By administrating these 4 genes altogether, we can reprogram our cells, somatic cells, blood cells, back into the embryonic state, and that's why we can generate iPS cells. So we reported mouse iPS cells in 2006, almost 20 years ago, and human iPS cells in 2007. iPS cells have the 2 important same 2 properties as ES cells, shown here. First of all, we can expand iPS cells as much as we want. Then we can convert iPS cells into virtually all types of cells that exist in our body, like brain cells, beating heart cells, liver cells, and so on. So because we can generate a huge amount of human cells from each of you, we are hoping that we can utilize these cells in achieving longevity, in overcoming diseases. Like today, I have many opportunities to talk about iPS cells, but actually, I did not make iPS cells by myself. iPS cells were generated by many members of my laboratories, especially these 3 young members of my lab, Yoshimi, Kazu, and Tomoko. They were all in their 20s, so without them, we could have never generated iPS cells in my laboratories. So I owe them a lot. After generating human iPS cells, our university, Kyoto University, decided to start a new institute. That is Center for iPS Cell Research and Application. We call it CYRA. We have a common purpose, vision. It is to bring this technology, iPS cells, to patients. There are 2 major medical applications of this technology, shown here. So once again, we can generate iPS cells from each patient, and we can expand iPS cells as much as we want. Then we can make brain cells, heart cells. By transplanting those brain or heart cells suffering from brain disease or heart diseases, we should be able to recover the function of those patients. This approach is called regenerative medicine. The other application is to use those cells in university or in pharmaceutical companies to understand diseases and also to search for drugs for each disease. This approach is called drug development. So let me talk about regenerative medicine. In multiple companies, clinical trials are already ongoing using iPS cells. In Japan, in our country, more than 10 clinical trials are ongoing, like Parkinson's disease, macular degeneration, and so on. So these are all phase 1 or phase 2 clinical trial, very early, small-scale clinical trial. So the primary purpose is to confirm safety. And I'm happy to report that so far we have not heard any severe side effects from these multiple clinical trials. Clinical trials are ongoing also in other countries, including US, Europe, China, and I haven't heard any severe side effects, including tumorigenicity, tumor formation. So I'm now more and more confident that this technology is safe. Regenerative medicine using iPS cells is safe. And also, we have heard that already some sign of efficacy from these early stage of clinical trials. For example, my colleague, Jun Takahashi, actually, he is now the director of SIRA after myself. He's been working on Parkinson's disease, which is caused by the loss of function of dopaminergic neurons. Jun can generate functional dopaminergic neurons from iPS cells, and they have already conducted clinical trial on 7 patients. They injected dopaminergic neurons from iPS cells into 7 patients. They are now, I heard their paper has been accepted by Nature, so you will know the outcome of this clinical trial very soon. I heard the outcome is very promising. The other promising application is blood generation from iPS cells. In this case, Koji Eto, another colleague of mine, they have been generating functional platelets from iPS cells. This approach is extremely important in countries like Italy or Japan. We are all graying societies, so we are having more and more elderly people who need blood donation, who need blood transplantation, but we are having fewer and fewer younger generation who can donate their blood. So in 5 or 10 years, we are going to short on blood donation. It's going to be a huge problem. So making blood cells like platelets from iPS cells is a very important alternative to blood donation. Another important application of iPS cell-based cell therapy is cancer treatment. Many scientists, like my colleague Shin Kaneko and many other scientists in Japan, in US, in Europe, they have been working on this approach. They are generating functional immune cells attacking cancer cells so that we can produce alternative new treatment to patients suffering from advanced stage of cancers. So this is not by my colleague, but by my collaborator, Professor Koji Nishida of Osaka University, who has been working on cornea diseases. So now they can generate this kind of transparent cornea sheet from iPS cells. And they have conducted clinical trial in which they transplanted these iPS cell-derived cornea sheet into patients suffering from cornea diseases. This clinical application was really remarkable because patients received these new cornea cells. Actually, they can see much, much better right after the surgery. So not only safety, but also efficacy has been proven in this clinical trial. Very recently, another collaborator of mine, a group in Keio University, they reported very promising outcome of their clinical trial for patients suffering from spinal cord injury, subacute spinal cord injury. They transplanted neural stem cells from iPS cells into patients suffering from subacute spinal cord injury. It's a complete injury, so patients cannot move at all. They performed this transplantation on 4 patients, and 2 out of 4 patients, they observed remarkable recovery in 2 out of 4 patients. So I would say this approach is also very, very promising. So I don't have time to explain all of ongoing clinical trials, but I would say all of them so far are very promising. So let me move on to the second medical application of iPS cells, which is drug development. So I will give you only just one example, which is ALS, amyotrophic lateral sclerosis. This is a very tragic disease caused by progressive motor neuron death. So in early stages, patients feel some muscle weakness in their fingers, and also when they are speaking, they feel something is going wrong. But in 1 or 2 years, they show difficulty in speaking and also swallowing. And in 2 or 3 years, they cannot breathe by their own. So it's a very, very tragic disease. But they can still think, they can still sense, so that makes this disease even more tragic for patients and also for their family members. So far, we don't have any effective drugs for these patients. We do have some promising drugs for mouse model of ALS, but unfortunately, all of those candidates turned out to be not effective in human patients. So we have to use human models, not mouse models. Now, with iPSC technologies, we can have a very good human model. So many scientists in the world, including my colleague Haruhisa Inoue, they have been generating iPS cells from ALS patients. Then they differentiate iPS cells into motor neurons. They found as soon as they generate motor neurons from ALS patients, those motor neurons start to die. In great contrast, motor neurons from healthy iPS cells do not die. That means we can recapitulate motor neuron death in petri dishes. Because iPS cells, we can expand iPS cells as much as we want, we can prepare thousands of petri dishes containing patient-derived motor neurons. That means we can test thousands of drug candidates at the same in one time. That's exactly what Haruhisa did, and he identified one existing drug, bosutinib, is effective in preventing motor neuron death in iPS cell-derived motor neurons. So because this drug, bosutinib, has been used in patients, in clinics already, this is a drug for leukemia. So we have many data already. Because of this, he was able to move to a clinical trial very quickly, within a few years. And he did a phase 1 clinical trial on 9 patients, and he found 5 out of 9 patients responded very well to bosutinib. Actually, by bosutinib, their disease, progression of their disease has stopped. Whereas the remaining 4 patients, he did not observe any responsiveness. So it's not in all patients, but at least 5 out of 9 patients, this drug turned out to be effective. And also what is very important is that we may be able to predict which patient is a responder and which patient is not a responder by measuring blood level of neurofilament L. So as you can see here, these 5 patients showed lower neurofilament L level in their plasma. So we may be able to predict which patient will respond in advance. So they are now conducting a much bigger phase 2 clinical trial. So it's been almost 20 years since our report of mouse and human iPS cells. In the last decade, we observed very rapid progresses in iPS cell technology. Originally, we generated 2-dimensional cells, like dopaminergic neurons, heart cells, from iPS cells. But now, many scientists are producing 3-dimensional tissue known as organoid, or even some scientists are trying to generate organ from human iPS cells. And furthermore, some scientists may be able to generate new organism, new life from human iPS cells. For example, this is an example of organoid research by my colleague Kenji Osafune. He is a kidney doctor, and there is a very important kidney disease known as autosomal dominant polycystic kidney disease, ADPKD. In this disease, in these patients, the kidney will form this kind of multiple cysts in their kidney, which result in kidney failure. So it's a huge problem. And Kenji has been generating iPS cells from these patients, as well as control patients, and he generated 3-dimensional kind of mini kidney organoids from iPS cells. And as you can see here, he was able to recapturate cystic formation in iPS cell-derived kidney organoid. So once again, they can generate this kind of organoids, many of these organoids. That means he can test many different drug candidates simultaneously. And indeed, he was able to identify one very good candidate for these patients, and he has started clinical trial. So this is an example of organoid research. Scientists are now making brain organoid, heart, cardiac organoid, liver organoid, and so on. Some scientists, actually, this is my friend, actually he's my kind of hero, Hiromitsu Nakauchi. He has been trying to generate human organs by using human iPS cells. It is still very difficult to generate human organs in vitro. So instead, he's been using large animals like pigs. So they have generated like pigs in which one gene essential for like kidney formation or pancreatic formation has been deleted. So these animals cannot survive because these pigs cannot form kidney or pancreas. But by transplanting human iPS cells into the embryos, into their blastocysts, they showed they can actually rescue these animals. And in these animals, at least in theory, they have pancreas or kidney derived from human iPS cells. They have not succeeded in this human-pig combination, but they have succeeded in like mouse and rat combination. They have successfully generated like mouse kidney in rat and vice versa. So this is not a scientific fiction anymore. Another progress here is, this is also my friend in Kyoto University. He has successfully generated functional sperm and oocyte from mouse iPS cells. And they were able to fertilize those sperm and oocyte from mouse iPS cells. And they are now working on monkey iPS cells. So in the very near future, they may be able to do the same from human iPS cells. So now I have a huge kind of dilemma. I started iPS cell work in order to overcome one one ethical hurdle, which is the destruction of embryos when making human ES cells. And I was able to, we were able to overcome this ethical hurdle by making iPS cells. We are happy in the beginning, but now we realized by making iPS cells, we have started new ethical issues, like making human organs in pigs, or making sperm or eggs from our blood or skins. It's, at least in theory, it's possible. So we started this work in trying to overcome one ethical issue, but ended up starting new ethical issues. So it's a very, very kind of difficult situation. So there is no simple answer, but discussion is very important. So when I was the director of CIDR, we decided to bring this group of people who are bioethicists in our institute. So in the same building, we have scientists working on iPS cells, but we also have a group of bioethicists talking to us, scientists, every day in the same building, how much we should do, how much progresses we can make. So once again, there is no clear answer, at least in myself, but this kind of discussion, transparent discussion, is very important. So with this, I would like to finish my talk. I thank you again for your kind attention. Thank you very much.